Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me is Afsin, he's the founder and CEO of SIBA Healthcare, which provides integrated telehealth and connectivity solutions to medical providers and hospitals. Afsin, it's great to have you with us. Welcome to Trade Talk.
Thanks, Jill. Thanks for having me.
Tell us more about SIBA Healthcare and what problems you're trying to solve in the healthcare space.
So SIBA Healthcare is an integrated telehealth platform. We do an end-to-end integrated telehealth solution for hospitals. It starts from integrating the medical devices from the bedside all the way, bringing this data at high frequency in front of the hospitals and in front of the physicians at a remote location. So we're solving the interoperability issues that the hospitals face today.
Who are your biggest competitors, if any, and how is your technology different than your peers?
So we have a couple of large medical device companies that we compete with that play in the area, but we see ourselves as the next generation of telehealth. We created a platform called eConnect, which is an IoT platform, and we encourage all these medical device companies and system providers, other third-party software companies to come and join the platform so that we create an integrated healthcare and we bring these high-speed data, real-time data, create these predictive alerts that can help the physicians. So our competitors, we don't see them as competitors. We see our competitors as our stakeholders.
Which U.S. hospitals and systems operate within SIBA Healthcare?
SIBA is a global company. First of all, we play in U.S. in a bunch of states, New York, New Jersey. We started our implementations in Ohio, but we also have started our systems operating in the Gulf region and Eastern Europe. But clearly, U.S. is a very large market for us. It's one of the most sophisticated and large markets, and our business is growing in the U.S. market.
What are some of the operational and efficiency benefits provided to medical providers by using SIBA Healthcare technology?
So SIBA, during the pandemic, what we face today is the lack of ICU beds, lack of physicians and nurses, and even them really getting scared going to the bedside. SIBA is creating a solution where we can turn into any kind of healthcare setting into an ICU type of room. And we bring a real-time patient monitoring into that room so that the physician can be sitting at home or some part of the world in real time and seeing these patients, monitoring them, and potentially also giving orders from our mHealth platform called Doctor ICU, watching the patient's ventilation waveforms, which is a very proprietary technology for us. So we're basically bringing the physician a technology as if he's at the bedside without getting infected, just by going into the room and just checking the medical devices and see how the patient's going.
What are the culprits or perhaps the downside of AI-based platforms for the caregiver and the patient? Are you still getting the same quality of care than you would have if the doctor was in the room?
It's a great question. First of all, AI, we see AI is a big part of our solution today. It was not like a couple of years ago, but because of the pandemic, what we realized is there's a clear need for predictive analytics, actionable information for the physicians, for these telehealth providers and telehealth companies to be successful. For example, in the ICU settings, the biggest cause of mortality, 55% of the mortality is caused by sepsis, and 15% is caused by acute kidney failure injuries. So if a solution like SIBA's can predict sepsis, onset of sepsis 6 hours ahead of time, you're not only saving lives, but you're also saving a lot of money for these healthcare providers, which is a big issue today. So AI is going to be a big part of telehealth solutions, and I think SIBA is making a very big lead in the AI. Our AI engine is sitting on the servers of the healthcare provider, the hospital, and it constantly scans this big data that's coming in, and timely intervenes, gives an option to the physician timely intervene these patients.
So it sounds like COVID-19 accelerated a lot of these trends that we were starting to see in health tech and telemedicine.
It did. There's a major momentum, and the whole healthcare system, the way the healthcare is provided has changed for good. And SIBA is basically getting a lot of attention. Our solutions are getting a lot of attention. Everyone's talking about like this might be a peak, a one-time thing, but it's really not. The way the healthcare is provided today is changed to a tele-ICU or any tele-program, which protects the physicians also, which there are a lack of them, and also saves a lot for the industry as well.
Yes, so it sounds like many of these telemedicine trends are going to continue on the other side of COVID-19, or certainly be integrated to what we currently know now.
Sure. COVID-19 just initiated, bring the momentum, and many people realize the space, and a lot of money is being put in place here just to improve these technologies. So it's just the start of this. We did have pandemics in the past, and the only thing they did was, push the technology and improve the technology. So yes, I mean, pandemic is just an initiator for these technologies, and tele programs are here to stay and even get better. I mean, our value proposition today is we are the next generation, and we are even changing the centralized telehealth model into a decentralized model. Doctor ICU application is our virtual healthcare platform, where today, in a tele-ICU setting, you're trying to bring in all these physicians and nurses into a remote hub. But look what happened. I mean, these people cannot even leave their homes, and all these patients, they need care at the hospital setting. So Doctor ICU application with a decentralized model, a physician at home at another part of the world can see their patients in real time, ask for consultations, and connect with the other healthcare teams, and really add value. So, even today, the market's changing to a very different level.
It's really interesting. It's like decentralized finance, decentralized health, but it's great if you can have access to whether it's your primary care physician or a specialist who's not necessarily on the ground, but can help to consult virtually to the other medical teams. So my question to you, Afsin, is what's next for SIBA Healthcare?
SIBA Healthcare, well, we're trying to grow our business. We're trying to grow our team. SIBA is in the midst of a capital raise, and this is purely to support our platforms. There's a major pipeline in US and the other parts of the world. So we will continue to lead in terms of the connectivity side, continue to lead the market, because eConnect IoT platform is definitely a game changer for the hospitals, especially today. So we will be investing more on our products and on R&D and grow our business.
All right, Afsin, thanks so much for joining us on Trade Talks.
Thanks, Jill. Thanks for having me.
And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.